Everyone, this is John. I'm 52 years old with transfusion-dependent thalassemia. I've been getting transfused for over 45 years, which is kind of crazy, right? Who could even imagine all those decades of being transfused? Anyhow, today I wanted to talk to you about Reblozyl. Reblozyl is also called luspatercept. That's a generic name. It was approved in 2019 to assist in the treatment of transfusion-dependent thalassemia and try to decrease the frequency of transfusions. It's an erythroid maturation agent, which means it gets the immature cells to mature. And so, the idea is to have more of a fully functional red blood cell. And there was a study before this was approved that said that found that 21% of patients studied were able to reduce their transfusion frequency by a third. And then there's a placebo group that only 4% were able to decrease their transfusions by a third. And so decent results, not stellar, but not terrible. So, I wanted to do everything I could. So I started getting Reblozyl back in right after it was approved. I made sure I told my physician, I'm going to try this out, despite the risks, which I'll get to in a little bit. But essentially what it was is a subcutaneous injection. I had to show up at the hospital every 3 weeks. So this was kind of, sometimes it fell on transfusion days. Sometimes it was kind of a little after. So it was an extra trip to the hospital, which, it was okay. But later on, you're supposed to get labs before you get the Reblozyl injection. So I would show up to the hospital, and initially I was getting in and out of there, with the injection. But then they started making me have to wait for labs, and it got to be really cumbersome. So even though the frequency of my transfusions were reduced, I still had to show up extra to the hospital, which, it made it a little cumbersome. So my experience initially, when I started taking the Reblozyl, the first 3 weeks I had headache, little back pain, little facial jaw pain, and that went away after, 3 weeks. So as I went on, my results were actually pretty good. I got to a point to where I was getting transfused 3 units every 5 weeks. So, my numbers looked great. My hemoglobin was super high. I wasn't getting as much blood, so my ferritin was going down. And the only problem was I did not feel great. My theory is, I don't know, how true this is or what, but I think it inflated my numbers without improving, my oxygen carrying capacity. I don't know how great those mature red blood cells really are, in a thalassemia patient. Reblozyl has been around to treat myeloid leukemia. And so maybe their results are different because they're already producing, their own red blood cells as it is. So, that's just my thought. I don't think it made me feel any better, although it did make my numbers better. Now, here's the thing. I would recommend Reblozyl or luspatercept if you're somebody who has a super high iron level or ferritin, iron deposition in their organs, and you want to get those numbers down. You want to get your iron level down, and you want to improve your hemoglobin to decrease your transfusions. I highly, highly recommend it for that reason. But if your numbers are already good, your iron level's normal, I don't see that there's all that much benefit. Personally, that's just my experience. Other people might say, differently, but, that was my experience with it. The other thing is there are certain risks involved with Reblozyl. First of all, if you have a history of clots, it's contraindicated, or, if you've had a splenectomy, you have an increased risk for clots. So, caution is really advised with that. Also, if you're on hormonal replacement therapy, or if you have a history of extramedullary masses, like on your spine or in your bones, it's use with caution or don't use it. So, again, this isn't medical advice. Speak with your physician and, read the literature. I'm not looking at the material right now, but that's my general overview of it, my review of it. And lastly, I just think if your iron levels are super high, talk to your physician. Say, let's try this Reblozyl out. It might be worth it to be on it temporarily, to get I stopped taking the Reblozyl back in October of 2023. My results started being not as great as they were, and I wasn't feeling any better. And also, the lab requirement prior to the injections was too much to keep going to the hospital like this. So, I elected to stop it, and my transfusion requirements have actually increased quite a bit. So I'm doing 3 units, every 3 weeks, 2 to 3 units. So that's where I am now. I'm about to get gene therapy with Zynteglo, which I have another video about you can check out. But yeah, my frequency's increased, so obviously my chelators have increased. I'm on J-Denu, so I'm taking 4 tablets a day, 360 milligrams and a piece. And that's where I'm at. So if you like this video, found it informative, go ahead and like and subscribe to my channel. I'm going to have a lot more information here about different things with thalassemia. Anyhow, I hope you guys have a great week, a great weekend, and I will talk to you soon. Take care.